Hello. My name is Nora, your digital presenter for today's event. Before we dive into the exciting and informative content we've prepared for you, here's a quick disclaimer. I'm actually an artificial intelligence (AI) designed and programmed to assist with sharing valuable knowledge and resources. I am here to provide evidence-based, up-to-date information and guidance, and will be sharing real stories from my colleagues at FND. Here at FND, we value honesty and transparency in all our interactions. We, at the Family Network on Disabilities, believe that the incredible advancements in technology, such as AI, can significantly enhance our ability to provide families with the resources, support, and information they need. All the information shared in this training comes from the dedicated team of experts at FND, who have years of experience, rich understanding, and most importantly, a deep passion for supporting families just like yours. Family Network on Disabilities began in 1985 by a group of parents of children with disabilities who came together looking for mutual support. FND is a grassroots organization for persons with disabilities and their families that is family-centered and family-driven. What makes FND unique is that the majority of our board members, our management staff and program staff are either individuals with experience with a disability or have family members with a disability, which gives us the perspective of empathy and compassion for the work that we do. Before we begin, I'd like to share a little bit about Family Network on Disabilities. We are a 501c3 nonprofit organization helping families across the state. We're funded in part by the U.S. Department of Education and the U.S. Department of Health through the Health Resources Services Administration. We use all that funding to provide information, resources, and support, and training to families, educators, professionals, and providers throughout the state. We do not charge for our services. At this time, we would like to make a disclaimer that we at FND are not attorneys, doctors, or mental health professionals. We do not offer legal or medical advice in our workshops. We are happy to support you with information, resources, and support. We use research-based information in our training and materials. Today we're going to be talking about ADD and ADHD. So let's get started. So what exactly is ADHD? How does it affect one's life? What are the symptoms? What can we do to help? Today we will review what is ADD, ADHD, some of the signs of ADD, ADHD, and how we can help children and young adults succeed and prosper. Attention Deficit Disorder (ADD) is an attention deficit. Attention Deficit Hyperactivity Disorder (ADHD) is characterized by overactive, impulsive, or a combination of both. These are usually diagnosed as ADHD. We have learned from many studies that ADD/ADHD is neurological. Some children with ADHD primarily have the inattentive type, some the hyperactive impulsive. Those with the inattentive type are less disruptive and are easier to miss. Being diagnosed with ADHD, older children have ADHD in partial remission when they still have symptoms, but no longer meet the full definition of the disorder. Knowing the different types will help to make sure all the proper steps are taken on the evaluation to avoid a misdiagnosis. Attention Deficit Disorder (ADD) is the most commonly diagnosed behavioral disorder of childhood, affecting an estimated 3% to 5% of school-aged children. ADHD is diagnosed much more often in boys than in girls, in a ratio of 4 to 1. A study looking at gender differences in ADHD found higher rates of females internalizing their feelings, where boys are more common to externalizing feelings. Most children with ADHD also have at least one other developmental or behavioral issue. ADHD affects school performance and interpersonal relationships. Parents of children with ADHD are often exhausted and frustrated. Neuroimaging studies suggest that the brains of children with ADHD are different from those of other children. These children handle neurotransmitters, including dopamine, serotonin, and adrenaline, differently from their peers. We know that ADD/ADHD is neurological. Early intervention testing and evaluation can be beneficial in helping your child succeed. Repetition is quite helpful. Follow through with the interventions that are being implemented in the school, at home, and vice versa. In the following set of slides, we will look at what ADD/ADHD might look like for a child, young adult, or adult. Some usual symptoms and behaviors of the inattentive type are as follow. Children may fail to give close attention to details or makes careless mistakes in schoolwork. They may have difficulty sustaining attention in tasks or play, and often do not seem to listen when spoken to directly. Other manifestations of this type could be that the child does not follow through on instructions and fails to finish schoolwork, chores, or duties in the workplace, difficulty organizing tasks and activities, and may avoid or dislike tasks that require sustained mental effort, such as schoolwork. They also may often lose toys, assignments, pencils, books, or tools needed for tasks or activities, be easily distractible, and forgetful in daily activities. The inability of finishing work in the workplace or school is not a cause of laziness. It comes down to having a short attention span and impatience, which is very common in children with ADHD. Hyperactivity found in children with ADHD may include fidgeting with their hands or feet, or often squirming in their seat. They may often leave their seat when remaining seated is expected, or runs about and climbs in inappropriate situations. Hyperactivity can include difficulty playing quietly and often needs to be on the go and acts as if driven by a motor. Excessive talking can also be common. Common examples of impulsivity is that a child with ADHD may blurt out answers before questions have been completed, difficulty awaiting their turn, or interrupting or intruding on others. We often see this combined with hyperactivity. Here are 3 basic steps you can take when you suspect your child may have ADD or ADHD. First, you want to research. You want to speak to your child, get an understanding of where they're coming from and try to understand their symptoms. Then, you want to speak to the teacher, your guidance counselor. Maybe schedule a meeting with the school to see what they're seeing in school. Then interventions and evaluation, follow up with a doctor's visit, getting in front of that pediatrician and to explain what's been going on in school and at home. Based on the information that you've gathered from your child and the school, going to the pediatrician and seeing how they would like to follow up with an evaluation. At the same time, you can also be working with the school to see what kind of evaluations or supports that they may want to incorporate. Evaluations are critical for diagnosing ADHD like we mentioned before. You want to have that diagnosis because that's where we can see where your student may be struggling. From there, we can figure out how to support them. Now for evaluation, diagnosis based on ADHD symptom must be present in more than one setting. As we mentioned before, you're looking at what is happening at school and at home. A clinical evaluation should be performed if ADHD is suspected. One of the most important parts of the evaluation is to be honest during that process. The American Academy of Pediatrics has issued guidelines to bring in more clarity to the issue of ADD/ADHD. The diagnosis is based on very specific symptoms, which must be present in more than one setting like we mentioned. Parents, teachers, and family members are encouraged to absolutely be honest during this evaluation because it could mean a major difference in the outcome. You want to be honest. This is not the time that anyone is judging. This is a time where we are trying to gather as much information to be able to support your student, your child, your loved one. Medication is a personal decision of the parent and the medical doctor. Some of the medications used for ADD/ADHD treatment can include Ritalin, Focalin, Adderall, Vyvanse, Strattera. These are some of the most common used medication. Children who receive both behavioral treatment and medication often do best. Medication should not be used just to make life easier for the parent or the school. There are now several different classes of medication that may be used alone or in combination. Psych stimulants are the primary drug used to treat ADHD, and although these drugs stimulate the central nervous system, they have a common effect on people with ADHD. Alternative remedies have become quite popular as well, which includes herbs, supplements, and even chiropractic manipulation. Here are some helpful suggestions that we've put together on this slide and some other slides going forward. Limiting distraction in the child's environment, providing that one-on-one instruction with a parent or teacher. Then, making sure that your child gets enough sleep, that their diet is healthy with plenty of fiber and basic nutrients. Exercise is of course important, at least 30 minutes a day. Then, we're not looking at exercise just in the school, we are also looking at exercise at home and in the community. Identify the behavior and implement replacement behaviors. What you want to do is give that child a clean slate every day. We're not bringing the issues that we had the day before. We're picking one problem at a time, and we start with basics. Focus our rewards on only one or two behaviors at a time. Once the behavior is well established, we can gradually replace other rewards with natural consequences. Here are some strategies to help children succeed as well. Be patient, the child needs lots of extra attention and many things repeated. Provide as much positive attention and recognition as possible. Catch the child being good. When you're seeing them doing positive things, that's where you want to provide that attention. Move around the room to be physically close to. We're talking about a teacher to a student, and answer questions if the need arises. Sit on a therapy ball while doing homework, that's another suggestion. Let your child sit near you, or if they're in the school, in front of the classroom, and then deliver consequence and rewards more immediately and frequently. Use signals for silence. Reward the child for sitting still or short or long periods. Again, we want to praise the child often for specific things. If they're doing something specifically, you want to be able to praise them so they can understand the positive things that they're doing so that you can have these behaviors repeated. Use preferred activities as incentive. Again, you want to engage them as much as possible and then help them feel comfortable asking for assistance. Other recommendation or strategies you can look at are fidget spinners have been successful. Fidget boxes, silly putty, cush balls, these are just naming a few items that research has shown to support children that have that hyperactivity. Movement, here are some additional strategies. Get a routine together. It's important to set a time and a place for everything to help a child with ADHD understand and meet expectation. Establishing simple and predictable routines for meals, homework, play, and bed. Have your child lay out clothes for the next morning before they go to bed. Then, make sure whatever they do to take to school is in a specific place ready to grab. Simplify schedules, it's another one. Again, trying not to put too many things on their calendar at once. Communicate with school and teachers. You're going to want to do this as often as possible. Great communication can almost guarantee success. Then, help them enjoy math. Have silly games to play and pictures to draw. Keep them entertained. Enjoy reading, read to them and act out the story. Constantly challenge them. Make bets on what's going to happen next. Keep them involved in the story. Recording lessons, if that's an option. If they're losing their attention and having a difficulty time staying on task, it may be best to have something recorded that they can use at home. Then, make them feel that they are part of the class. If we have any teachers listening, this is a good opportunity for that child to feel like they are part of the class. Ways to improve attention to direction. Make directions clear and concise, and simplify complicated direction. Check with the student to make sure that they understand the direction. Some of these can also be incorporated into a student's individual education plan if they have one. Use both oral and written instruction for activities. Have the student recite directions or difficult concepts in munition, and then ask open-ended question, not yes or no. Students will most likely just say yes when they don't understand. If they have to explain stuff, that's where you would be able to support them more. Positive outcomes on success. ADHD is long-term. Approximately half of children with ADHD will continue to have symptoms as adults. Every effort should be made to manage the symptoms and direct the child's energy to constructive positive outlets and educational paths. Having them participate in extracurricular activities, having them participate in community events and activities, again, help them to be able to use that energy constructive. Many people with ADHD are successful in jobs and communities. Here we have some pictures of some famous people that have this diagnosis. Singer Adam Levine, actor Jim Carrey, Ryan Reynolds, Robin Williams, Justin Timberlake, Olympic swimmer, Michael Phelps, actor Will Smith, Olympic gymnast, Simone Biles. Just to name a few famous individuals that have a diagnosis of ADD or ADHD. Here you can see our FND family. These are the programs housed under the Family Network on Disabilities. Each program provides a unique service to a specific population. There are 3 PTI programs, funded by the U.S. Department of Education through the Office of Special Education Programs. POPN serves North Florida. PSN serves Southwest Florida. And PEN serves Southeast Florida. The Family Star Program, funded by the U.S. Department of Health under the Health Resources Services Administration, and supports families of youth with special health care and mental health needs. FND also has a Special Needs Trust, where we provide families with information regarding creating and supporting a special needs trust. We also do programming specific to fathers raising children with disabilities. Here you can see links for multiple downloadable resources available in various languages. You can also see some of our social media platforms. We have various pages on Facebook addressing the needs of different populations and our programs. I invite you to check out our website at www.fndusa.org for the hundreds of pages of resources and invaluable information that you can access and download at no charge. You can reach us to help you and your family by giving us a call at 800-8255-736 and letting us know your needs. You'll be assigned to a staff person who can support you. Follow us on Instagram, Facebook, and TikTok. Visit our website for valuable resources and more information. We want to thank you for spending this time with us during this presentation. We look forward to hearing from you.